Welcome to Medica's video podcast. My name is Varun. I hope you're all doing well. Sexually transmitted diseases, sexually transmitted infections are a dark side of our healthcare. A lot of people may not be interested to talk about them in public forum. That is why they have requested us to talk about it with a doctor and clarify their doubts. We will also be talking about skincare as well as healthcare, and the topics that we are going to discuss today may not be covered anywhere else. So don't miss a point and stay tuned till the end. In order to discuss this subject, we have Dr. Indra Priyadarshini joining us from Chennai, Tamil Nadu. So without wasting time, let's welcome her.
Hi Varun. Hi.
Hello, doctor. How are you
Hi.
doing?
I'm good. Hope people
Great.
are also fine.
So I'm doing wonderful as well. Thank you. Ladies and gentlemen, we have Dr. Indra Priyadarshini. She is an MBBS, MD, dermatologist, venereologist, as well as a leprosy doctor. So she is here to discuss about some various interesting, shocking, and thrilling topics about skincare, hair care, and also sexually transmitted diseases with us. So these topics that we are going to discuss today, you may not be able to find them anywhere else. However, let's try to keep this discussion as simple as it is and as interesting as it can be. Okay. Dr. Priyadarshini, first of all, thank you so much for accepting our invite and joining in for today's discussion. Dr. Priyadarshini, without wasting any time, I directly would like to ask you about various skin-related diseases you might have encountered in your clinic, right? So I'll quote some examples based on the research that we have gathered. There are some cases where we have seen, these are some trends we have seen in TikTok talking about sunscreen contouring. We are talking about some SPFs is a common word. Anyone you touch, they know what is an SPF because most of them may be using sunscreens, both men and women. So in order to make their skin naturally bright, people have started using this SPF based sunscreens of various levels and also the skin contouring. So some doctors have warned them that it may cause some cancer. At the same time, we have seen some cases where it resulted in some chemical burns because of the do-it-your-own acid peels that they may have done at their home watching some YouTube tutorials. In your case, Dr. Indra Priyadarshini, what kind of bizarre or rarest of the rare skin cases you have experienced and what kind of counseling you have given to those patients?
Yeah. Hello. Yeah. Coming to the topic directly. So, yes, I am seeing so many patients getting influenced from the social media, following lots of skincare. Those are not even needed for the skin. So they layer too many products to the skin that is actually not needed. So I have seen so many patients coming with burns, as you said, they do peels at home. Though they are home peels, they should know how to use it correctly. So if they don't use it correctly, they will definitely burn the skin. That is one thing. And also, what they do is they layer too many products. The trend now is the Korean skincare. So now people are like too much behind Korean skincare, and they think the Koreans have glassy skin. It's actually
Yes.
not so. So the Korean skin itself is like that is okay to be followed in Korea. Okay, so we don't follow their diet. We don't have similar climatic conditions, right? So whatever is needed for our skin, whatever is okay to be applied on our skin in our climatic conditions is okay. But these layering of 10 products, 10 steps is all like waste of time, waste of money, and waste of everything. So it's not going to give so much benefits also. In fact, if you layer too many products on the skin, it's going to give more acne only. So
Correct.
I would say follow whatever is needed. And if you don't know what to like, people are always in confusion. Like they don't know exactly what to buy, and they buy almost too many products, and they use it for a few days. They feel it's not working, and they change to one more product. So don't do that. Whatever doubts you have in skin, please visit your dermatologist, and they will let you know what products to use, which is suited for the skin, and whatever they will let you know exactly the procedure and the routine and all that. And coming to like what else you were asking, like the skincare trend is now this Korean skincare. So I would
Yes,
say
I was
that.
actually about to ask you about the Koreans. That's actually my next question. So, as soon as we talk about the skincare and also hair care, we immediately hear another term called serums. right? So why have these serums become so popular nowadays? And everyone is now running behind that Korean skins, right? I want to ask you one. I don't know if this can be a funny question, but please don't mind if that's the case. So you kind of
It's
mentioned
okay.
because the skin is glows based on the climatic conditions, the genes, as well as other factors also, right? We
True.
have seen some cases, correct me if I'm wrong, some people who are living in the hot and humid conditions, they ideally look a little darker. And those people who live in much colder conditions and much less light conditions look a little fairer. So in the same way, so is that actually does it actually happen? Does the heat as well as the sunlight affect the color or the fade of our skin?
Of course, yes. See, the main problem in our country is pigmentation. Okay. See, the
Okay.
color, the natural color is decided by the race, genes, and all that. But
Okay.
if you want to stay in your natural color, you have to use some sun protection. That is very important. If a fairer or a wheatish tone person goes and works in the sun for such a long time, definitely he's going to become more darker only, because tanning is something that is actually protective for us, but it's not cosmetically acceptable, right? Also, we have seen so many skin conditions related to like sun related or just light related. So it's always better to use a sunscreen, and definitely people do tan when they go out in the
Oh,
sun, and
yes.
definitely
That's
they do
correct.
become a shade darker also.
Right, right. Ma'am, when we talk about the sun tans, I have this question again for you. We have seen this term called sun bathing, right? So where people go out in the sun and they intend to tan, right? So I believe, correct me if I'm wrong, I believe it is necessary for those people who never see sun in their climatic conditions. Do you think it is also necessary for people in India or in those countries where there is abundant amount of sunlight and they get exposed to this abundant amount of sunlight, do they still need to go out and do these sun baths by applying the
Not
sunscreens? Do you think
necessary.
it is necessary? Okay,
See, if you apply sunscreen, there's no point in going and getting again exposing in the sun. Okay,
that's
it's
right.
anyway going to protect your skin from sunlight. So
Yes,
there's no point there. And I don't think so. Indians go and leave the fairer part people. They might again go get some vitamin D. They think they'll get some vitamin D from sun, so they go take some sun baths. But mostly it'll happen in Western countries only. But have you
yes.
noticed Western people, like more like foreigners, they do the sun bathing and all that. But have you seen them tanning? No, they'll just turn red because they don't tan
Yes,
naturally.
exactly. Oh,
They don't
okay.
tan. The skin just turns it like into red. That's all. Tanning won't happen
Oh,
because they don't have much melanin in them. But
okay.
when we take Indians, our people, when they just go out for some 10 to 15 minutes itself, they will tan because we have so
Yes.
much melanin. So for us, the sun bathing is not at all needed. We don't
Okay,
need
great.
it.
Well, thanks for the clarification, ma'am. Then there is one more question I want to ask you about the tanning itself. So, de-tan and de-tanning serums or de-tanning creams have become a big business. Is tanning actually harmful? Is one question of mine. Number two, if you get tanned, how long does it take for your body to detan by itself? Does it happen automatically, or should you really go and get these detan skins and all? Why are people so obsessed about these tans and they want to immediately, rip them off from their skin by giving business to these products?
Firstly, tanning is protective. Okay, why
Oh,
tanning
okay.
happens is whenever our skin is exposed to light, the melanin from like below it comes and shields the nucleus that's there in the skin to prevent any DNA damage, in turn preventing cancer. That's why skin cancer is
Oh,
very very rare in our country, our gene and
oh,
our race. So it's protective, and that's why the tanning
okay.
happens. So of course, when you go for a vacation or something like that, if you don't follow any sun protection like applying sunscreen of any physical clothing or something like that, people are going to tan only. So that's protective.
Okay.
Don't worry about it, okay? And it is reversible only. No need to do anything for it. You just have to leave it like
Great.
that. And if you continue using sunscreen properly itself, it'll slowly fade, and you'll get back your natural skin tone in a month or 6 weeks. So the tanning
Oh,
will, even if you don't apply sunscreen, at least if you protect your skin by covering with clothing itself, tanning will go. Okay,
Okay, okay,
so no
wonderful.
need to, in fact, if you apply the D-tan creams or serums, they are actually not going to work. It's just a waste of
Okay,
time and money. So don't go behind D-tanning. It's not going to work anyway. You have to
great,
give it
great.
some time and it will take its own time to reduce.
Wonderful. Thank you for the clarification, man, because people are running behind these D10s because the summer is already here. People will get exposed to the sun. They feel that this tan is a foreign body, which is probably making them de-glamorize. But ladies and gentlemen, listen to the doctor. It is actually protecting your skin from unwanted cancerous cells being produced in your body. So it is good for you. It will reverse by itself. So if you have any questions, go to doctors. Don't go for this unnatural methods of detanning your bodies and give them business and get unnecessary infections or unnecessary things in your body. Thank you so much for that clarification, ma'am. Ma'am, I have one more question I want to ask you related to this facial, things and all. There was this case which we have actually observed. There is this lady who's got treated by an unlicensed doctor, right? So they have injected counterfeit Botox in her facial skin, which resulted in a facial paralysis. Now, the biggest question, why did I raise this topic? And the biggest question many of us have is, whom should I go for my skin care? Skincare. There are, a dermatologist or even a saloon person who's actually sitting there is talking about, detans, is talking about you must have heard about this gold packages, silver packages, all these for face packs I'm talking about, right? Whom do I
Yeah.
trust?
Let me explain. See, if you have any skin, hair, or nail related issues, or if you have any infections around your genital area, or if you suspect to be like if you're traveling to any leprosy endemic countries or states like that. So, if you have any of these problems, you will have to consult only a dermatologist. Okay, so now you're asking, how will I know he or she is a dermatologist? So you can easily find out how means like if you go, obviously people will see the board outside. They might get carried away by the term cosmetology clinic or something like that. So it's okay, you go inside. Obviously, if he or she is a true dermatologist, they would have put up their registration board in the clinic. At least if that's not there, you can see the registration numbers being put up either on their name boards or in the seal which they're going to put on your prescription pad. So you can easily get to know their registration numbers. So whichever
Right,
state you are in, you have to go to the online. You can check if they are the qualifications of the doctors. So how do you check
right,
is you can go to the state medical council website. There you can type their registration numbers and you will get all the details of that specific doctor. So in that way
fantastic.
you can find truly like if they are the dermatologist or no. So when you were talking about the botox, so all these are dermatology procedures only. There's nothing specifically or separately cosmetology course that's available.
Okay,
So I am seeing like so many quacks like putting videos, running clinics. They
right,
are like if you see, they would have put up like fellowship in UK, Russia, like that. So all these fellowships are not at all valid in India. There are only
okay,
three courses, that is National Medical Commission recognized and
okay,
Medical Council registered, Indian Medical Council registered. So only
yes,
these three courses are there. Either they would have done MD DVL
okay,
or DNP DVL or Diploma in DVL. Other than
okay,
these three, there's no other course that is valid. They cannot
okay,
practice any such procedures. So in that
okay.
way, you can be sure that you are in safe hands only.
Great,
And
great,
if
wonderful,
you
man.
get
Thank
these
you.
procedures done under a dermatologist, these palsies, the ptosis of eyes, and all won't happen.
Right, right. I mean, thank you for that clarification because it's very important whom we are appearing, whom we are approaching for our healthcare
Very,
issues and
very
all.
true.
And there is one other point that we always see, especially with respect to the skincare itself. We may probably call it as, grandma's treatments or old mom's treatments kind of a thing and all. So a lot of these skin care related stuff is taken care at home with the home, remedies. So how far these home remedies are successful? What are those that are successful that can be safely practiced? And for what conditions we should definitely go for a dermatologist, like you just mentioned a little earlier.
Yeah. So you were talking about the grandma stuffs, right? All these were
Yes.
there when we didn't have a proper product to be used on, safe products to be used on. So those were the times when nothing was available. So they were using whatever is available in the kitchen and they were applying. But now that science have developed so much and we have so many safe products, each product we can use for specific indication. Okay, so if you ask me, I would say no only to any kitchen related products. You can eat
Okay.
them, that's those are okay, but please don't apply anything to the face. Everything
Okay.
else is harm.
Even haldi and all, because there is a function
I
that we celebrate during marriages called haldi function.
Yeah, see, yeah, but I have seen so many patients who had got turmeric allergy.
Allergy. I know what you're talking about. Yes.
Yeah, so all these are harsh to the skin. Better not
So
to
we
apply.
don't know whether we have that kind of an allergic reaction or not, so better to avoid. Okay, I got your point, ma'am. All right.
Yeah,
Yeah. So any of the skin conditions, you don't want any home remedies to be taken care, is it?
no, please. We have better
Okay.
options for.
Okay. Ma'am, how about these cases when you have some blisters? Because we often see these cases, especially with cooking people, whoever it can be man or woman, they tend to work with oils as well as different hot things. So they tend to get, some sort of blisters, some sort of burns for that matter. Is there any quick thing that you expect them to do before they approach a doctor, like applying some ice, or what do you want them to do for a burn or for a blister?
See, these types of burns are very, very common that will happen in everyday living. So, what you have to do immediately if you got some burn or scald formation or blister formation is immediately show your skin under running water and keep ice. Keep
Okay.
ice over the affected area, and then you can actually apply an antibiotic ointment or a silver
Okay.
based ointment, or you can use the epidermal growth factor gels. Like these are available easily in their markets. Like you can use any scar gels also, they will help in quicker recovery. So all these can be done, provided
Okay.
it's not like anyway to get infected it will take some few days, but if it is infected you will have to definitely go to a doctor.
Great. Okay, great. Thanks for the clarification. Doctor, now we are talking about the scars as well as removal of scars, right? So a lot of people at some stage of their life, they might have got some scars. These scars may be related to an injury or it may be related to some infection also. Let's take for an example, chickenpox infection. We see a lot of people after the infection is relieved, they still have those scars and some kind of pores on their face. Is there any way they can clear the skin and go back to normal as to how it was earlier?
See, scar itself is permanent.
Oh,
Scar is nothing but some collagen or some part of the dermis and the fat is like dermal part is damaged. So
oh,
scar is always permanent. No cream is going to give you 100% results. Okay, and
okay,
also these scars, if it is fresh scar, like if it is just 2 weeks since the chicken pox or whatever injury or even acne will give you scars. So if it is less than 2 to 3 weeks, you can start using scar creams or scar gels over the scar sites, so that you will get some 40 to 50% response.
oh,
But if
okay,
you use the scar gels, if you want the scar gels to work on older scar, like more than 6 months, 7 months, even a year or two, it's not going to give you any result. That is there.
oh,
And of
oh,
course, scars need procedural treatments. So there's no way to remove scars. We can manage scars. We can make it look better. That's what we
okay,
can.
okay. Okay. Got it, ma'am. Thanks. Ma'am, now let's talk about some people who actually have, see, usually skin aging is something which is very common. It happens over the course of time, right? So, however, we have been seeing some case studies where a lot of people who are in metros or in thickly polluted areas have seen skin aging, and acne or pimples also have increased or predominantly more compared to those people who are living in a less polluted areas. So, what are your thoughts on this?
True. Pollution itself will cause more acne. Pollution itself is going to give you more pigmentation. And see, that's why we repeatedly say, please protect your skin with sunscreens, a proper moisturizer, and also cover the skin. Some kind of physical protection is also very important. See, creams are not going to protect you from pollution, right? Something you have to cover to protect from pollution. So these are very, very important. Pollution, what it does is the dirt particles will trigger inflammation on the skin. That is why it is causing more pigmentation, and they'll clog
Oh,
the
okay.
pores, and that is why we get more acne. So
Okay.
please use some physical protection to protect your skin from pollution.
Right. And there are some people where it's practically not possible for them to protect their entire skin from pollution. They have to get exposed to that kind of pollution and all. Like, let's take for an example, traffic police. It's impossible. They have to stand in that hot sun. First of all, they're getting tanned. Secondly, all the pollution around them. There is no way for them to escape from either one of these. What are your suggestions to such frontline warriors like traffic police? What will you suggest them to take care of their skin?
Of course, they have to also apply sunscreen regularly, 3 to 4 hours once at least, because they are always outside, they are always under the sun. So that is very important. And of course, they wear a cap that will okay give some kind of protection from the sunlight. And what else they can do is they can at least wear some mask that they can do, right?
Okay. Okay.
Yeah.
Okay. Yes. Yeah. Thanks, ma'am. Thank you. Ma'am, there is this again, this can be grandma's thing again, where a newly born child every day will be applied some I think castor oil, or it can be some till oil to their bodies, and those children will be exposed to sun for some time, and they say this will actually strengthen their body and their bones, and also makes their skin shine better. So, what are your thoughts on that procedure?
See, they can be applying coconut oil just before bath, like for massaging.
Okay,
That is okay. But
okay,
no other oil is good for the skin. That might cause allergy again to the newborn skin, because
okay,
their skin
okay,
is very sensitive, and you're not supposed to use like other products and all to the skin. That is one thing. Also,
okay.
even when you try no apply oil, go stand in the sun, it will be shiny only.
Yeah,
So the shiny thing
yes.
is going to happen only. So but that's just
Okay,
temporary. Okay, that's not
okay,
going to
okay,
last. When you wash off
okay,
the oil, the shine is going to go. That is there.
okay,
Also,
okay.
even nowadays, like doctors are not advising to show the newborn under the sunlight to promote
Hmm.
vitamin D, because that's
Okay,
again not happening, because sunlight is now becoming more harmful only, not like before days and all. Our ozone
right.
is getting depleted. Our UV rays are like more of harmful UV rays are we are like coming into the earth. We are getting exposed to harmful rays.
Yes, ma'am.
So
Yes.
nobody is advising to show their newborns in the hot sun now. So they
Okay,
are just
great.
prescribing vitamin D syrups, and that is fine.
Okay, okay, great. Ma'am, I'm going to ask you one question. I think this would be again a funny one. See, whenever a police catches any person on the road who doesn't have a helmet, the first reason they say, especially women, please don't take me wrong, with all due respect, they complain is, if I put on a helmet, I will start getting my hair fall. My hair falls and I'm going to lose my hair. This because helmet is for our protection. Police has been trying very hard in order to adhere to in order for us to adhere to that. But this is a common complaint everyone talks about. So is that really true? Does hair really fall because of putting on a helmet?
Um, can't say it's totally false, because
Okay.
helmets, like if you wear tightly or you keep it very dirty, then it might cause friction, and because of that, your hair strands might break. That is the
Okay.
only way where helmet might increase your hair fall. That's all. But
Okay.
wearing helmet doesn't cause hair fall. In fact, that
Okay.
is very, very important. I advise all my patients, like whoever comes, like they ask for some skincare, no? So I advise them, added to sunscreen, you have to wear a helmet that has a sun protection in the glass. So I advise all my patients to wear the helmet. That is very, very important, more than anything else,
Excellent.
right?
Excellent. So all
But
those
helmet
who
is
are
not
giving
going to cause hair
hair
fall.
fall, exactly, man. So I'm just giving a word out to all of you who are giving excuses to police that my hair falls if I put on my helmet. You're hearing it directly from the doctor. Helmet doesn't cause hair fall. If required, probably you can put on a skull cap. That will be an extra layer in between your hair as well as the helmet. Thank you for the
And you have to
clarification.
wash it. You please get
Yes.
3 to 4, change it. Don't use the same thing. Don't use the
Sa-
dirty ones. And you have to clean the helmet also. How to clean is you can just spray some sanitizer or something, wipe it from inside. Wash your scalp at least weekly 3 times. So keep
Yes.
your scalp and other stuffs clean. That is more than enough. And if you experience hair fall beyond that also, you will have to consult a dermatologist because problem could be from inside. So we
Yes.
have to
Yes.
address what it is and we have to correct it accordingly.
Great, great. Thanks, ma'am. Thank you. Ma'am, now we are talking about hair fall. Some people, they feel that they have been following everything. They never had a hair fall in their life, but suddenly they see an increase in the number of hair strands falling in every day. Everyone knows that a certain amount of hair strands will fall on a daily basis whenever they comb their hair, whenever they rub their hair with some towel and all. But then again, when these are some research oriented news articles that has been coming out that there is this woman who complained in Reddit saying that my hard water in my apartment is causing my hair fall, and this is something that we hear it from a lot of people, and that is how this water softeners business have also increased. Is it really true? Does hard water really cause hair fall?
See, hard water is generally harsh. Okay,
Okay.
it's going to be harsh on the skin as well as harsh on the scalp. So, skin, what will happen is if you use something that's harsh, it's going to dry out your skin. So, in turn, dry skin will cause eczemas. Dry skin is going to give you more itch and all that. Scalp also similar problem is going to happen. The hard water is nothing but more salts in it, right? So the salts
Okay.
will be like just deposited on the scalp, and in the long run, what will happen is you will start seeing more of itchiness, and because of which you will scratch more. The strands might break, and that is why they might experience extra hair fall when they say, I recently shifted home and here the
Yes.
water is so hard. So that's the reason. Other than
Okay.
that, if you just use hard water, it's not going to fall that much. These are the
Okay. Okay.
reasons it might cause. So what you have to do is definitely water softeners are very good. You have to go for it. Also, one if you cannot suppose if you are living in a rental home and you cannot afford for the softener and all that,
Yes.
what you can do is only when you wash your scalp, you can use some the 20 to 30 rupees can water, and that water you can use it to wash your
Oh,
scalp. That is one
that's a great
alternative
idea.
you can.
No,
Yeah.
that's a great idea. I'm sure very few people would have thought about it. I think because I was about to ask you, because there is no way to escape from this hard water, especially for
Yeah.
those who are tenants. They may not have this water softener kind of a mechanism. So yeah, those water cans might be of real help. Thanks. I mean, that's a great idea
Instead
that
of
you said.
spending like so much, you can actually, this is like okay only to spend. Like you will get
Yeah,
some
yeah,
20 liters.
absolutely. Yeah, yeah,
Yeah.
yeah. 20 liters, you get it from 50 bucks or 100 bucks. And I think that much you can afford at least for hair instead of spending a lot of money on these water softeners and all. Ma'am, there is this another dilemma that public really have. There are various brands of shampoos available, starting from Ayurvedic till we talk about some international brands available. And there is another side of an argument that says shampoos cause hair fall. And the reasons what they say is also about the sulfate level what they have, as well as some dry shampoos have something called as benzene. It's a chemical,
Benzene.
benzene in it, which causes cancer. What are your thoughts on it, doctor?
See, first of all, let's finish off the dry shampoo concept. In India, nobody is using dry shampoo. Okay,
Oh,
so
okay.
dry shampoo is nothing but they use some spray kind of shampoo with no water itself. You can clean the scalp.
Oh, okay.
Yeah. So, have you seen anybody using
No,
dry shampoo?
I don't think so. Anyone uses dry shampoo. It's not available in retail shops also, and I was a little confused there. That's why I thought I'll ask
Dry
this.
shampoos are nothing but they are shampoos only, but they are in spray form, and you can wash your scalp, like you can clean the scalp with no water. So
Okay.
I don't think so anybody in India will use that dry shampoo. So of course dry shampoo has a lot of benzene in it, and benzene is
Oh,
something that's carcinogenic. So that's why a
okay.
few years back we got this news like trending. A specific brand
Okay.
shampoo was causing cancer. So even now,
Okay.
like if I advise them to use some brands, like specifically that brand, people used to ask me, oh, that causes cancer, can I use that or not?
Oh,
So they are not even
okay.
aware that's just the dry shampoo that's causing cancer and not the
Yes.
normal shampoo. So dry
Yes.
shampoo
Yes.
concept is not here anymore. So that is
Right.
okay. And coming to shampoos causing hair fall. See, shampoos are just to clean the scalp. They are not going to cause hair fall or not going to increase your hair growth. So that you should
Okay.
understand.
Ma'am, then I have a question. Sorry to interrupt you there. Why is there a lot of publicity happening around anti-dandruff, creatine-based shampoo, intense care, anti-hair fall? I mean, if it's just a kind of a liquid which just cleans our scalp, why is that? And it also helps you in hair regrowth. I'm like shocked actually when I heard about it. So why is all this marketing happening
See
around?
again, yeah, again, people don't know, right? They get carried away by these like hopes, promises, and all that. So shampoo is
Yes.
just going to stay for few seconds, right? In few seconds, what do you expect it to do? Nothing.
Yes.
So it's just to clean the scalp. Of course, the anti-dandruff shampoos which we prescribe are medicated ones, and we
Okay.
advise them to leave it for 5 to 7 minutes so the drug in it will act, and then they can rinse it off. So that way,
Okay.
the medicated anti-dandruff shampoos will work.
Okay, okay, got it, ma'am, got it. So, ma'am, when we talk about this hair fall, I was actually doing some research and I've realized that there is this technique which is approved by FDA called JAK inhibitor. So this is a new invent.
Jack.
Yeah. So this is JAK inhibitor, which is actually working really well. It's an inhibitor drug, it seems, actually working very well for the hair fall. Is it really true? Is it available in India?
It is available. The JAK inhibitors are available. In fact, they are like very good. But in whom all we should use is one thing. It's a drug. It's a prescription drug, right? So
Okay.
it is only FDA approved to be used in certain skin conditions and hair loss conditions only.
Okay.
Everyone cannot use it, okay? And
Okay.
those will be prescribed by your dermatologist if you really need it, after doing certain investigations, after ruling out any infections, after ruling out the TB and all that.
Oh,
Then only it will be prescribed, and then you can use
okay.
it as per the doctor advises you. So they are
Okay.
not
Okay.
something that's available OTC, over the counter.
Okay. Correct. Got it. Ma'am, how much hair fall is okay? Because we have heard it from different people and all. How do I evaluate if my hair fall has passed that stage to go to a doctor?
Yeah. See, up to 100 hair fall per day is okay, normal. Because
Okay.
your hair will fall and then it will grow back. Okay, we have
Okay.
three phases: anagen, telogen, and then ketogen. So your hair will fall and then it will grow back. But when
Mm-hmm.
you have to raise your brows is like if you have so much hair fall suddenly every time you comb your scalp, if you get like so much hair, bunches of hair like that, if you get, then it is alarming. That is when you have to visit your dermatologist, and simply don't waste your time trying the some hair oils to grow the hair, to stop hair fall, using anti hair fall shampoos. All these are not going to work.
Okay. Ma'am, I want to ask you on this context. There are some people and there are some advertisements and companies are saying that, onion juice, aloe vera juice or oil is going to be very helpful in the hair regrowth I'm talking about. And also, I was talking about this minoxidil is also going to help very well in terms of the hair growth. First, can you clarify because this onion-based oils as well as shampoos have actually taken over the market. Does that really help in hair growth and arrest the hair fall?
See, we there's one condition called alopecia areata. Okay, so there we see patchy hair loss. So,
Okay,
so that is actually an autoimmune condition. So in
okay,
that, one of the mode of treatment what we give is an irritant, giving an irritant. So
okay,
all these onion, scrubbing the onion over the bald patches and all will act as an irritant. In that way, it might bring back the follicles. That's all.
okay,
Other than
okay,
that, onion oil or onion shampoos are not going to help that much.
okay,
The
okay, okay.
the
Glad.
aloe vera and all that is harmful to the like harsh on the skin. I have seen like so
Okay.
many allergies happening because of scrubbing aloe vera, the natural aloe vera from the plant they scrub. They feel it gives some moisture, it removes tan and all that, but it is going to give more of dryness, and it is actually going to increase your itching only.
Okay, okay. Ma'am, in the cases that you have seen in your clinic, so have you encountered any case where it actually shocked you with the practice what the patient may be doing and it was, it actually threw you out of the park in terms of a surprise?
Of course, like we see like so many patients on a daily basis, and many of them use the OTC drugs. Like once the doctor would have prescribed them for one problem. So what they do is they use the same prescription for years. Whenever they get
Ah,
some problem,
yes.
they turn back the prescription that was given years back, and they'll use one or two drugs from there, and they'll like feel okay for a few days, and they'll stop it again. When it recurs again, they'll do the same
They will
mistake
go
and
back to
stop
that
it.
prescription. Correct, ma'am. It not
But
only
when they
happens
come
in
to us,
dermatology case. Yes.
yeah,
Yeah. But
when
all
they
the
come to
cases
us, it'll
usually.
be
Yeah.
like
Yeah.
fully flared up and complicated. They come to us in
Okay.
that state only. Until then,
Okay.
they'll keep doing something that is calming them.
Yeah. Do you think it's quite common in India because it's not just
It's
related to
very common.
dermatological cases, all
It's
the other
very common.
cases, people will follow the prescriptions that were given months and years ago. Only when situation doesn't turn in their favor is when they come
Yeah.
back to the doctor with all hands up.
Yes,
So
very
this
true.
I've heard this
So
and I've
many
also
patients
experienced
do
it.
that. Yeah.
Exactly,
Also,
ma'am.
when it is
Exactly.
like just starting, also they don't want to get treated. When it is very horribly itchy or when it is very, very troublesome for
Yes.
them, then only they'll come and visit the doctor.
Exactly. And as soon as it disappears, again, they don't want, even if you ask them to revisit after a few days to see what the condition is, they won't come back because already their
They
issue
are
is resolved.
okay. They
This is
are
a
okay with it. They are
typical
relieved
condition.
from the acute illness
Yes.
and they are happy and they'll go back.
Yes.
They'll not
Yeah, yeah.
even come for follow up. But
I can imagine
nowadays,
myself as a patient.
I am seeing like now people are becoming more responsible. So when we ask for a follow up, they do come actually.
Oh, they do? Okay, great.
Some two,
Wonderful.
3 years back also, they were like once they are fine, they won't turn back. But nowadays, at
Okay.
least they come to show. They
Okay.
show that like it's good. Thank you, doctor. It's been like very good
Great.
like that.
Wonderful, isn't it?
So
Yeah.
in that way, like we also feel happy.
Great, ma'am. Thank you for that. Ma'am, there is this, it's exclusively for corporate employees I'm talking about, whoever is working under those blue lights or white lights. There is this common misconception, or probably you need to clarify if that's a misconception or not. Those who sit under the light and work, they tend to get a lot of hair fall. You have no idea, especially in corporate world, especially in employees. I've seen it in my office too. People don't sit under the lights directly. They tend to either sit in the left or in the right cubicle. They will not sit in the cubicle which has a light right above their head because they believe that it may cause a hair fall to them. Is that really true?
This is something new to me as well.
Okay.
So,
Okay.
see, lights will increase the pigmentation. It's going to
Okay.
cause more pigmentation. That is
Okay.
like well known. So, we
Okay.
advise people, everyone who is working even indoors, we ask everyone to use a sunscreen, okay,
Okay.
to protect the skin from lights. But this hair fall thing is new and that's not true also.
Okay, thank you. Thanks for the clarification. A lot of us are actually relieved because we are unable to fill those seats. Okay, now, ma'am, let's now talk about some infectious diseases and exclusively related to STIs, right? So, people usually say sexually transmitted infections or diseases will be caused because of unprotected sex, right? So, this is something which everyone knows about it with the evolution of this polygamy as well as the extramarital affairs and wherein you can have multiple partners and you can be open about it and all, do you think time has come to even doubt your spouse or your partner whom you're actually meeting with? Do you think you should also have protected sex with your partner so that because I'll actually quote a case study and then probably you can answer this question. There was this woman who's married. Okay, this has actually come in the news, right? She's married, and after that marriage, broke, or probably the husband has left. I don't remember exactly. She actually went with many partners in the light of love and affection or whatever it is. So one of the partners went and got admitted in a hospital, and and they realized it is a sexually transmitted infection, which is nothing but an HIV.
Hmm.
When he rewinded back, he realized that it's the only partner he met with, which is this lady. And when
Hmm.
they questioned this lady in the way she's supposed to be questioned, she kind of mentioned that she has been infected with this HIV with one person. She wants to take revenge and she went and infected, you cannot imagine, 50 plus males. And none of them know about this HIV. And God knows how many other people they would have gone and met and how far this would have been spread. So
Yeah,
that is why I want to ask you,
that's a
do you
concern.
think do you think it is now a situation where you need to have protected mating even with your trusted partner?
See, if you really trust them and if you're really loyal, then there's no need of protected sex. But see, yes, if you have a doubt or if you want to meet somebody who you don't know, you will definitely have to use some protection. Not some protection, barrier protection is very important. So people think if they say if they take oral contraceptive pills, they're safe. No, the barrier protection is the one that is going to protect you from sexually transmitted diseases. Okay, the OCP or pills or whatever, they are just going to prevent your pregnancy. That's all.
Okay.
But to prevent from sexually transmitted infections, you have to use some barrier protection. And when you
Okay.
know you're infected, please do take treatment. And HIV, for now, you have to take treatment for lifelong. And yeah, please have some responsibility and please don't at least spread the infection to anybody.
Okay. Ma'am, this HIV treatment you're talking about, because this will actually help for those people who are already suffering with this HIV and may not be coming out or getting treated because of the social stigma. So you kind of mentioned it is a lifelong treatment. By taking this treatment, can they still continue to live the lifestyle they want to?
Of
Or
course, they
will they
can.
have to alter their lifestyle, and sound separate, look separate versus the other society that they see?
They just have to be responsible in not transmitting the infection to anybody. That is what is
Okay.
their responsibility, and they have to do that. Other than that, they can lead a normal life. But if they have, it all depends on the viral load and the CD4 counts. If the CD4 count is very low, then they might get infections, any infections for that matter,
Okay.
bacterial, fungal, or viral. They'll be getting again and again, so they will have to take specific treatments for it. So in that way, they will be suffering, but other than that, they can lead a normal life if they don't have any symptoms.
Okay, okay. Ma'am, usually the sexually transmitted diseases, it is very difficult for partners to actually reveal it to each other. Did you happen to encounter any case where a partner has come to you and it appeared to be an STI, but then again, you probably had to do a separate or a private counseling to understand it was actually, from anyone else. So did you happen to encounter these kinds of issues at your clinic as well?
Of course, but like when I was doing my PG, like we used to get so many patients.
Okay,
What is our responsibility is we have to find their point of contacts and
okay.
inform those people that she's infected and all that.
Oh,
That's the responsibility that we have. Like I was doing my PG from a government hospital in Hyderabad, so we have the responsibility to prevent the infection. So
from for the
the
spread. Yeah, okay.
yeah, so whoever she's contacting or she is very close with, we have to get them, like we have to talk to them, we have to let them know like this infection is so and so and it might spread. So we will educate them to like take treatment and not to spread anymore, and like not just HIV, there are many more sexually transmitted infections like syphilis is like easily treated. So other than HIV, we have like syphilis, herpes, donovanosis, and lymphogranuloma venereum. Like that, few conditions are there. All the other ones can be treated easily. So we advise them to take treatment properly and stop the spread and not to spread to anyone else.
Okay. Ma'am, when you actually call them and you say that, you might probably would have been infected with some STI, what was the reaction?
See, most of them will already know that their
Oh,
partner is
they
suffering
know?
from
Oh,
some kind of infection, but they don't care usually. But we tell them
oh,
that you have to take treatment, otherwise this, like we mentioned few complications, then they would come to us and take the treatment. Some
okay.
people might not know. In that case, they will be definitely shocked, and they will be, of course, they'll be like very grateful to us. Thank you,
Okay.
you told us. We will come to you and we'll take the treatment. So they'll be
Yes.
okay to take the treatment at least.
Okay, great. Ma'am, answer this question to me. So let's say if there is a person who's already infected, right? So usually this happens in, I think I don't know, maybe it happens otherwise also. Let's say if there is a person who's already infected, who's probably a prostitute, right? So she has no other way but to continue to be in that profession. And there is a person who comes to do business with her, and he doesn't want to have a protected sex. He wants to have an unprotected sex, right? She tries to educate him by saying, hey, you know what? I am infected. So I don't want to pass on that infection to you. So you better have protected sex. So in that case, he may probably have an answer that that's okay. For once, I may not get infected. So my question to you is, even if for once what are the chances of getting infected? Is that low, or even if it is once, there is 100% chance you'll get infected?
See, if the women or the men who's having active infection, and when somebody is in contact with them very closely, they will definitely get the infection. So that
Okay, even if it is
less than
once.
1 or 2% chances they might not get,
Okay, they
but
might get away.
mostly they will get because see, the penile region has urethra, right? It has an
Yes,
opening. Likewise,
yes.
female reproductive, like female genital area is also opening only. So we have so much of mucus in it. So that's the
Okay,
mucous membrane we say. So infections will easily spread.
okay, okay,
So they should be aware, ideally, that they
okay,
might get
okay.
infected. If they are okay to get infected, then it's their thing.
Right, right. Ma'am, when such in sexually, but because people usually don't know what is an STI, they still feel that it's a normal skill condition and all. When they come for a treatment with you, either it can also happen for the younger kids also, because nowadays the sexual awareness has grown up, and you
Abuse
may
and all.
probably have encountered younger people, younger generation also with some STIs and STDs kind of stuff and all. What kind of a confidentiality as a doctor you maintain, or any doctor should maintain when treating such STI cases, ma'am?
See, of course, we will be confidential only. Okay, but until and unless it is likewise HIV, which you mentioned, we will
Right,
have
right,
to
right.
inform. We have specific government setups. We have to inform the government if we get
Okay,
leprosy, if we get HIV, if we get TB or something like that. We have to inform the government, and the government will take care.
okay,
The
okay.
medicines
But
also
when it comes to
will
the
be given
treatment,
free of
right?
cost from the government.
Okay. But when it comes to the treatment, the protocol, the confidentiality of the patient is still
Of course, it will
intact.
be
You won't.
confidential only. We will treat whoever is coming to us. We will treat and we will educate them.
Okay, okay, great.
Yeah,
So ladies and gentlemen who are already suffering with STIs, or who knows that they have been infected through some STDs or STIs and all, there's no need for you to worry that your identity will be revealed and all. Governments will support you, doctors will support you, your identity will be kept confidential. So please seek support, stop spreading these infections, which is not going to help anyways in our society. It is just going to make harm. It's not ideal as well. Thank you for the clarification, doctor. Doctor, there is this case, which is actually a social media trend. It's a viral that was going around, that STIs or HIV can be transmitted through saliva or through blood. Is that true?
yes, it's true. It can be
Oh,
transmitted through any body fluid.
oh, okay. I mean, I thought actually it is untrue, but you actually blew my mind. So,
It is true.
so HIV can be transmitted through saliva?
Yes, it is. It can be
Then
transmitted.
how do
And
we how do
see,
we protect ourselves? Then we are all exposed. We
like,
don't know who's
how do
infected
you
around
come in?
us.
Like, see, people who have oral sex or something like that, so they will get infected, of course. That is one thing.
Okay.
Also, like when you people, I have seen like one or two who did nothing, but they were tested positive for HIV.
I was about
How?
to ask that question to you.
Yeah,
What happened?
because they might have been like injected with some infected needle. So if you
Oh,
go
okay.
to some like, you have to make
Yes. Yeah.
sure whenever you're getting
The needle
injected,
is
you have
fresh.
to make
Correct.
sure the needle is fresh. So all
Correct.
these
Correct.
are very very important. If they reuse the needle that has been used to some HIV patient or some other infectious patient, you are going to get the infection because it's again blood, right? Especially the
It's
needle prick injury is like very very dangerous. Like you will
right, right,
definitely get the infection.
right, right. But this is something new. I mean, needle-wise, people are aware that they need to use fresh needles and all, but a transmission of an HIV virus through saliva is a shocking thing. I think we
It is,
need to really.
especially the transmission is easy when you have any broken skin or when you have any cuts on the skin. When the saliva
Okay,
or blood enters through the damaged area, then it is
okay,
very easily going to spread into the body.
okay, okay.
It'll get
Got it,
into
ma'am.
yours like very easily.
Got it, ma'am. Got it, got it. Ma'am, how important it is for, because we are in a thickly populated, highly densile kind of an environment. It's not like in US, people actually maintain some distance when you talk to each other and all. They don't really come into your neighborhood. When I say neighborhood, I'm talking about at least 10 feet, right? So in India, it's not quite possible. You have busy roads, you have busy buses and everything else. what is the ideal protection to ourselves, not only from STIs, but also from hair conditions or from, skin conditions, because some skin conditions are also transmissible, if I'm not wrong, by the touch, right? Like warts and all.
Yes.
So what is an
Yes.
ideal way to protect ourselves?
In our country, the most common communicable disease is TB, tuberculosis. So that
Hmm.
spreads very easily through droplet. So if you inhale, if your immunity is low, you're definitely going to get the TB infection. But it's
Oh, okay.
there, like in the atmosphere. If you have good immunity, you're safe. You're not going to
Okay.
get TB. See, I also want to educate people that TB is not just infection of the lungs. We have seen so many tuberculosis skin conditions also. TB can happen on the skin also. It can
Oh,
happen anywhere else in the organs also. So not just coughing all the time means you have TB. Any skin infection, if you like, you won't know. It will be very slowly growing. Please consult your dermatologist. If needed, we will take a biopsy and then confirm if it is TB or not, and then we will give specific treatment. So
okay.
these are very easily transmissible, and as you said, like few infections like fungal infections, viral infections like warts and all can spread through touch. So in that
Okay.
cases, you have to properly finish your treatment. Till then, you have to like not be in close contact with your nearby ones, and do not share your soaps and towels. All these are like very important to follow to
Right,
not
right.
spread the infection.
Great, great. Thanks, ma'am. Ma'am, when it comes to the skin infections, again, I want to ask you, especially we see a lot of skin rashes in kids as when they wear these diapers, because diapers culture has grown up big time because of the necessity. You can't really have these cloths carried all the time and all, but they end up in a diaper rash kind of a thing. So there are a lot of diaper rash creams that are available. So, how safe are they, or is there any alternate way to actually cover those, or rather to treat those rashes, or to prevent those rashes at all? Is the first question that I have, ma'am. The second question, what I have is also for the babies. A lot of mosquitoes around us is
Yeah.
actually forcing the parents to apply these roll-ons. There are some roll-ons and those mosquito repellent creams that they apply for the skin. How safe are they? Please answer these two, ma'am.
Yeah. See, diaper rash is very easily preventable. Diaper rash is not because of the diaper, that you should
Oh,
understand. Okay. It's
okay.
because you don't change it frequently and you just leave the
Okay.
feces, like you just leave the stools and urine for a longer time. It is going to irritate the skin, and that is when the diaper rash happens. So if you
Okay.
change it in proper intervals and you don't leave it like that itself, then you can definitely prevent diaper rash. Of course, diaper rash creams are available. They are nothing but zinc oxide, plain zinc oxide creams. So those zinc creams you can apply over the affected area, or even to prevent, you can first clean the area, apply the zinc cream, and then put the diaper to prevent it.
Okay.
So that is one
Okay.
thing you can do to prevent the diaper rash. Yeah, if you do it correctly, you will not even get rashes.
Great.
That is
Great,
one
ma'am.
thing. Yeah. And the next thing which you asked, like mosquito bites, right? Yeah.
Mosquito
See,
repellents,
instead of,
roll-ons.
yeah,
Yeah.
instead of using creams and roll-ons on the skin, there are these fabric roll-ons available for the kids.
Okay.
So what
Okay.
you do is you just have to put some four dots on the fabric, whatever dress they
Okay.
wear. That is more
Okay.
than enough. No need
Okay.
to apply
Okay.
anything on their skin.
Okay. Okay. I would like to ask you a very common topic, which is stretch marks. A lot of people have
Okay.
these stretch marks in various parts of their body. We talk about pregnant women having stretch marks on their belly. We talk about some people having stretch marks under the armpit or on their shoulders. And there are various stretch marks people have on their bodies. So, are they normal? Is there a way that we can get rid of these stretch marks? Can they be, completely disappeared on our body?
See, stretch marks, we call it as striae, okay? So they are nothing but scars. As I told you, scars are permanent. They are like damaged skin. The collagen is damaged there. So it's permanent. You can prevent it by, like in pregnancy, of course, you can't because the skin is stretching so much, but you can limit it by applying proper moisturizer to the belly every day, at least 2 to 3
Oh,
times. So in that way you can
okay.
actually reduce the severity of stretch marks and all that. When it comes to other people who lose weight suddenly, or like in that case mostly it happens, and for women also it happens wherever the thigh area, back of arms and all. So of course you can to some extent reduce how it looks by preventing it, like applying moisturizer again and again. Moisturizer is very very important for everybody to apply on the skin. And when you are in this weight loss journey, you have to apply some thick moisturizing creams that will help in suddenly shrinking the skin and suddenly damaging the
Yes,
collagen. So that is important.
correct.
And you have some procedures which you can get it done in the dermatology clinics, but you cannot get 100% results. Like once the skin is damaged only. Of course, it might look little better when you get these procedures done, like microneedling, radio frequency, and all that.
Okay, okay, glad. Thank you, ma'am. Ma'am, lastly, there is this case study which we have seen basically where a mole on the body turned out to be a cancerous case. So, is that real, by the way? But how do we differentiate a mole versus a cancer-causing skin place or whatever we want to call it as?
Okay. See, moles almost every one of us have, right? So
Yes.
moles are like it's normal to have, but when you have to watch it is when the specific mole is suddenly increasing in size, or when the color of it
Oh,
is changing, when it has some two
okay,
three different colors in it, then you will have to definitely look into it. You will have to confirm it by doing a biopsy and then totally
okay,
removing it. That is one thing.
okay,
And we don't see so much of melanomas in India. It's quite rare only. Acral region, it's okay, like it's quite common to have in India. But then also, it's not that common. It's very rare again. But if you
okay.
find any of your mole suddenly increasing in size or changing its color or giving some discomfort, then you will have to definitely visit your dermatologist.
Okay, okay, great. Thank you so much, ma'am. I believe, ladies and gentlemen, this has been an excellent discussion so far. We have discussed about sexually transmitted diseases. We have bursted some myths around the skin care, hair care, moles, as well as stretch marks. We have touched a diaper rash. We have touched cases related to infectious diseases, communicable diseases, and all. And I believe this information is going to build a lot of confidence in a lot of you, will save a lot of money to you, will actually ensure that you follow right practices, and also where to reach, whom to reach, and how to identify if that particular practitioner is a genuine practitioner or not. Dr. Indra Priyadarshini is available on our platform on either website, which is medicasapp.com. You can see it on the scroll below, or you can download our app from Play Store or App Store. She will be available for online consultation, and you can directly have a personal consultation with her. Doctor, thank you so much, ma'am, for your time. I really appreciate it. Until next time, ladies and gentlemen, have a very good day ahead. Namaste.
Thank you, Varun. Thank you. Thank you so much.